because that's the actual title. The title is, our title is Rethinking Medical Education for the Next Decade, 2035, right? So what is one simple change which can help the faculty? Because you are a faculty development expert. One important thing that change can help the faculty to teach CBME in a better way. And also to adding on to, I have not yet completed, madam. I'll finish up with another question also. How can the institution can support the faculty to feel more confident enough?
So one change is after each skill, after each procedure, after each case presentation, we can tell the student what went well and what can they improve upon. So this will give more motivation to the student and they know in which area they are confident in. So this does not require any extra infrastructure or does not take much of time. So if you practice this over the period, the faculty become very comfort in giving the feedback as well as they get more and more clarity about CBME. And the other thing is we can implement one of the innovative teaching methods. Instead of taking the didactic lecture, we can introduce a task-based topics surrounding that topic. For example,
to be very specific, madam, from my
yes.
side, uh, uh, I have completely known about this CBME and all these things after me becoming a resource faculty for BCME only. Okay, right. When you teach to our own faculty only, we learn much more.
Yes.
Yes, ma'am. Please proceed.
So we can do task-based teaching. One
Yes.
example I'll share. So in biochemistry, we teach biomedical waste management when they are in the first year. And this is very, very important in our medical profession. If something goes wrong, then everybody who are involved in the medical professions are exposed to that risk, plus including our community. So instead of just giving a content delivery, that is just the didactic PPT based classes, we give a set of ways to the student, ask them to segregate into different color coded bins. So we observe when they are performing it and then we discuss why they have selected that particular waste. So we are just shifting just the content delivery into a task based, the focused task based learning. So coming
so that they can learn much better.
Yeah, the retention of this will be a longer period. They retain it for the longer period. Then coming to the institutional supports, one, the department can plan the department level faculty development program. They can share the good practices that have implemented in the CBME during their department meeting so that they can handhold and help the other faculty to also implement it. The second one is allocation of protected time for teaching and learning and assessment. Sorry, teaching and learn, because assessment, that is our role. So the conflict between this clinical service, diagnostic service, because I belong to diagnostic service, and we always say we have so many reports to certify and we can't take so much of theory classes, small group discussions. So this conflict between this diagnostic service and the teaching can be reduced or minimized. And the third one is implementation of learning management systems and digital capturing system,
Absolutely.
which will reduce the burden on the faculty for documentation. And lastly, and the main important one is recognizing and rewarding those faculty who have done innovation in teaching and learning. This will motivate the faculty.
Thank you so much. I think one fine morning we'll receive a circular from NMC that LMS is going to be mandated in another 6 months. It needs to be implemented. So even if it comes only, then we'll proceed with this thing. Thank you so much, ma'am. What is your, I mean, to add on one more point, as an MU member and CC member, all of us, right? So as an implementation expert, what is your opinion? In spite of doing so much of, I shouldn't say this, donkey's work sometime, right? So as an MU member or CC member, because what sort of recognition that we get actually from the institute?
Please repeat, I did
recognition, like in spite of doing so much of MU related work, because it is all extra departmental, isn't it? Right?
Yes, sir.
I do. So maybe this question is from my heart, I guess. Right? I mean, all the questions are from my heart only. Yes, please, madam. No, this question anyone can answer, please.
You can take.
Please, ma'am.
So there is a saying, sir. There's a saying that in our setups, in general public sector workings, the one who does the work usually gets more work. The one who doesn't work gets salary. So we get more work. Somehow we feel happy with that work. That's it. It's a humanistic way of thinking of it.